Have you ever walked out of a doctor's office with your lab results thinking you had a complete picture of your health? Well, I'm here to tell you the reality is standard checkups barely skim what's truly going on inside your body. There's a hidden world within you that holds the keys to not just living longer, but living better. Welcome to the Longevity Show. I'm Dr. Hilary Lynn, and today we're uncovering the untapped potential of advanced biomarkers, powerful indicators that could transform your approach to health and longevity. Most medical tests focus on detecting diseases that have already developed, like checking cholesterol or blood sugar levels. But what if we could delve deeper, identifying risks and making ultra proactive changes long before any symptoms appear? What if the secret to a longer, healthier life is hidden in markers that most doctors aren't even looking for? In today's episode, we'll be exploring the advanced biomarkers that can reveal your body's secrets, markers that often go unchecked, yet hold invaluable insights into your future well-being. By understanding these, you'll be able to take charge of your health in ways you've never thought possible. By the end of our discussion, you'll know which biomarkers truly matter for longevity and how accessing this information can help you unlock a fuller, more vibrant life. Let's dive into the hidden science of optimizing your health for the long haul. What are biomarkers? Biomarkers are measurable indicators that provide real-time snapshots of what's happening inside your body. Found in blood, urine, saliva, and even through imaging tests, they offer insights far beyond the basic metrics we usually check. Think of biomarkers as your body's communication system, signaling everything from inflammation levels to hormone balance and immune function. While standard tests might measure cholesterol or blood sugar, advanced biomarkers can reveal much more nuanced information. Take C-reactive protein, CRP, for example. This is a marker that indicates inflammation in the body, a silent contributor to many chronic diseases. Elevated CRP levels can alert us to underlying issues before they escalate. Another crucial biomarker is homocysteine, an amino acid that, when elevated, can signal increased risk for cardiovascular problems. In conventional healthcare, biomarkers are often used reactively to diagnose a problem after symptoms have appeared. But in longevity-focused care, we use them ultra proactively. By measuring advanced markers like fasting insulin or omega-3 index, we can identify potential health risks early on. This allows for targeted interventions, such as personalized nutrition plans or specific supplements and medications aimed at optimizing your health trajectory. This ultra-proactive approach isn't just about preventing disease, it's about enhancing your quality of life or health span for decades to come. Biomarkers give us the tools to understand your unique biology at a deeper level, empowering you to make informed decisions that support long-term wellness. Now, let's first go over how to interpret conventional biomarkers. Conventional health panels are the standard set of lab tests that most people get during their annual checkups. Think of them as the basics of car maintenance. They're designed to check if your health is running smoothly enough to keep you on the road or not dead. They help catch common diseases or risks before they become major problems. But here's the catch. They're often finding issues far too late, after they've already started brewing. By this point, we often need to rely on expensive interventions and invasive ones too, medications or even procedures for conditions like cancer or heart disease. What if you could spot trouble decades before it becomes an issue? We'll talk about how to go beyond the basics and stay truly ahead of the game. If you're looking at your lab report from your primary care physician, this section will help you understand what those numbers mean and why they matter, especially if you didn't get enough time to discuss them with your doctor. And let's be honest, who has enough time to discuss these labs with your doctor? So let's break down some of the key components so you're empowered with the right knowledge to take action. First, we have the complete blood count, or CBC. The CBC is like a health check for your body's fuel lines. It measures red and white blood cells, hemoglobin, and platelets, the essentials for keeping everything functioning smoothly. If you have low red blood cells, that can mean anemia, which might indicate a nutritional deficiency or something more serious. Here's where it can get more interesting. Even the type of anemia can be identified through details like MCV, which stands for mean corpuscular volume, and MCH, mean corpuscular hemoglobin. For example, if your MCV is low, that's a clue you're possibly low on iron, a common deficiency that can lead to fatigue and poor performance. But if MCV is high, that's more a signal pointing to vitamin B12 or folate deficiency, which can impact your energy, nerve health, and even mood. But what about white blood cells? A spike can mean your body is fighting an infection right now. High neutrophils might suggest a bacterial invader, while high lymphocytes often point to a viral infection. There are also more subtle clues like eosinophils, which might spike if you're dealing with allergies or rarely a parasitic infection. In rare situations, your CBC might also indicate cancer, for example, leukemia. The point is, this panel remains on both conventional and longevity testing because it gives us valuable clues to what's happening under the hood. Next, we have the basic metabolic panel, or BMP. Picture the BMP as a performance check. It's looking at electrolyte balance, kidney function, and blood glucose levels. So let's start with glucose. If your fasting glucose is high, that could be an early sign of prediabetes even before any symptoms show up. Knowledge here means that you can take action before it's too late by adjusting your diet, increasing activity levels, and even perhaps taking a medication or supplement to prevent true diabetes from developing. Creatinine and blood urea nitrogen, BUN, are the conventional markers we use to assess kidney health. Creatinine is a waste product generated from muscle metabolism, filtered out of the body by the kidneys. Elevated creatinine levels can indicate impaired kidney function, as the kidneys are not effectively filtering out this waste. However, creatinine can also be elevated due to increased muscle mass or supplementation with creatine, which is why a substitute marker like cystatin C may be necessary for a clearer picture. I recommend this for most of my patients if they're physically fit or using creatine for performance, for their brain and muscle growth. BUN measures the amount of nitrogen in the blood that comes from urea, which is a byproduct of protein metabolism. Elevated BUN levels can indicate dehydration, extra high protein intake, or reduced kidney function. So typically in conventional medicine, BUN and creatinine are used together to assess kidney health, as their ratio can provide further insights into whether an issue is more related to kidney function, hydration, or protein metabolism. And electrolytes like sodium, potassium, and chloride, they're not just numbers. They're the unsung heroes keeping your muscles and nerves functioning well. Everything from your brain to your heart to everything else needs your electrolytes to be at the right balance. High sodium might indicate that you're dehydrated or perhaps consuming way too much salt in a rare situation, while low sodium could indicate a more serious condition like heart failure or even adrenal insufficiency. Potassium is crucial for heart and muscle function, so high levels might be linked to kidney dysfunction or certain medications, while low levels could point to inadequate dietary intake, excessive losses due to some medications, for example, or overuse of diuretics. For example, some people still do abuse diuretics to lose a little bit of weight, although that's all water weight. The BMP provides that snapshot of your metabolic engine, letting you know that everything is firing well or if something needs particular attention. So understanding your BMP numbers could be what saves you from a more serious condition down the road. Hemoglobin A1C is another valuable marker for understanding long-term blood sugar control. Luckily, in the last decade, we finally added this to most conventional panels. I remember when I was in medical school, this actually wasn't commonly added to panels. It was just something that you had to remember to add on. Now, luckily, most doctors are ordering hemoglobin A1C. So HbA1c reflects the average glucose levels over the past 3 months, giving us a more stable view of your metabolic health compared to a single point in time fasting glucose reading. So high HbA1c levels indicate poor blood sugar management, increasing the risk of diabetes and related complications such as nerve and kidney damage. So by monitoring and maintaining HbA1c within an optimal range, we can catch blood sugar issues earlier than if we were just using fasting glucose. Then we have liver function tests, or LFTs. The liver is our body's chemical processing plant. It works around the clock to keep toxins in check, produce bile, and store essential nutrients. LFTs like ALT, alanine transaminase, AST, aspartate transaminase, and bilirubin can give you a peek into how efficiently that processing plant is running. Elevated ALT and AST levels can indicate liver inflammation or damage, often due to alcohol use, certain medications, fatty liver disease, or viral hepatitis. High bilirubin levels might instead signal a blockage in bile flow, liver dysfunction, or hemolysis, which is the breakdown of red blood cells. Even mildly elevated levels can be meaningful, especially if they persist over time. One fun fact is that AST and ALT, as well as all of our blood levels, are measured against the standard of the average American in the US. And this is meaningful because the average person in the US is overweight or obese in most cases. And that means many people have fatty liver disease. So what is considered normal on a lab test might actually be normal for somebody who is obese. This is meaningful because we in longevity want to lower the ranges, the optimal ranges for things like your liver enzymes in order to pick up signs of disease earlier and act more proactively. Overall, your liver is so critical for detoxifying the body, processing nutrients, and maintaining metabolic balance. So catching liver stress early is key to preventing bigger problems later on. Cardiovascular disease is often called the silent killer for a reason. Most people won't feel any symptoms until it's too late. That's where the lipid panel comes in. So the lipid panel measures cholesterol and triglycerides, providing a window into your heart health. High total cholesterol, or LDL cholesterol, which is what we sometimes call bad cholesterol levels, are the typical conventional medicine red flags that indicate an increased risk of heart disease. Elevated triglycerides are also contributors to cardiovascular risk and are often linked to lifestyle factors like diet, alcohol intake, and physical activity. Interestingly enough, even though the word lipid refers to fat, we actually see greater changes in triglycerides due to changes in how much carbs you intake. So I see this very clearly. There's a link between metabolic disease and elevated triglycerides. Then we have HDL cholesterol. So low HDL cholesterol, which is the so-called good cholesterol, is another warning sign because HDL helps remove excess cholesterol from the bloodstream, acting as a scavenger. So the key here is balance. We want higher HDL cholesterol and lower LDL cholesterol and lower triglycerides as the most optimal combination. One quick mnemonic I usually tell my patients is no matter what the levels are, you want your HDL-C level to be higher than your triglyceride level. And this is helpful because oftentimes you're looking at the optimal ranges and you might actually fall into the optimal range for both of them. But this is just a sneak peek into ways that longevity-focused physicians actually look at lab results differently from conventional doctors. When we review these numbers, we're not just looking at the levels, we're looking at whether lifestyle changes today could prevent a heart attack 10 years from now. That's why checking your lipid panel with a fine-tuned comb is really important. Now let's talk about the thyroid. Conventional panels luckily all include thyroid stimulating hormone, TSH. So TSH is like the thermostat for your body's metabolism. It's produced by the pituitary gland and signals the thyroid to produce thyroid hormones, which regulate energy, metabolism, and growth. So if your TSH is too high, that can indicate hypothyroidism. I know that can be confusing, so let me say that again. Remember, the TSH is like a thermostat. So if it's high, that means your body's trying to turn up that thermostat because it's too cold, or the temperature is too cold, or the level of thyroid hormone is too low. So TSH too high, it means that the thyroid hormone is too low. And this can lead to symptoms like fatigue, weight gain, and even depression. On the other hand, low TSH levels might suggest hyperthyroidism, an overactive thyroid, and this can result in symptoms like weight loss, anxiety, irritability, and a rapid heart rate. I actually have a patient right now who's been dealing with this. She's going through Graves' disease, and unfortunately, this has impacted her life so significantly. We're titrating her levels of the medication we use in hyperthyroid very closely, but she's just so sensitive to even minor changes in the dosing. This test, TSH, can reveal both problems, hypothyroidism or hyperthyroidism, and they can impact your day-to-day life in really significant ways, even if these symptoms might seem subtle. The thyroid is so important because it's at the core of why many people might be feeling fatigue, gaining weight unexpectedly, or experiencing certain mood swings. So these issues can be corrected with simple interventions if we catch them early enough. One quick thing as a little bonus is if your TSH is slightly abnormal, or it's only been abnormal one time, I usually urge people to take a look at their overall health and correct any sort of big gaps, like if you're not sleeping well, if you're not eating well, if you're not doing at least a little bit of exercise, and then recheck your TSH levels. The reason is, in many people, it's within a range which is correctable without using supplemental thyroid hormone, or I never see this, but for example, by using medications to bring down the levels of thyroid hormone. That's usually not the problem. So these standard panels are crucial for diagnosing and managing health issues that may be already on the horizon. They're a reactive approach. But if you're here, I know you're interested in more than just putting out the fires. You want to learn how to optimize, how to truly thrive. And to do that, you need a proactive approach. Now, let's talk about tests that assess inflammation, metabolic efficiency to an advanced level, and hormonal balance. These are the real game changers when it comes to living longer and better. Think of these advanced panels as the tools that help you fine-tune a high-performance machine. They give you insights that are proactive, enabling you to address potential issues before they become serious problems and guiding you toward true vitality and longevity. So while fasting glucose gives you a snapshot of your blood sugar, fasting insulin is an even earlier signal that provides insight into how hard your body is working to keep that sugar under control. Elevated fasting insulin is actually the earliest indicator of insulin resistance, a condition that can precede type 2 diabetes by many years. So if you imagine a car engine that has to work twice as hard because something is clogging the system, that's like your insulin getting elevated because it's your body working overtime to keep things running smoothly. If we catch insulin resistant years early, you can make adjustments like switching to a lower carb diet or incorporating more resistance training before it turns into full-blown diabetes. In my own practice, I check fasting insulin on everyone. When you have a high fasting insulin but normal fasting glucose and hemoglobin A1C, that's such a satisfying time to intervene with lifestyle or some early medications. We often try dietary changes such as lowering the refined carb intake and intermittent fasting, which is often enough to bring those insulin levels back down in such patients. Next, let's talk about high sensitivity C-reactive protein, or hs-CRP. It's normally on the lab as little letters for HS, a dash, and then capitalized CRP. Inflammation is at the root of nearly all chronic diseases, from cardiovascular disease to diabetes to neurodegenerative disorders. High sensitivity CRP is a marker that shows the presence of low-grade inflammation. Elevated hs-CRP is like the smoke before a major fire. It might signal that something in your lifestyle or environment is causing underlying inflammation, whether that's stress, poor sleep, a sedentary lifestyle, or even subclinical infections. Certain groups are more prone to elevated hs-CRP, including those who are overweight, smokers, people with chronic stress, and individuals with autoimmune conditions. Imagine a person who seems really healthy but has a sudden heart attack. Often it's because low-grade inflammation went unnoticed. Elevated hs-CRP can help you spot such an issue really early and make changes, like improving your diet or managing stress better to prevent that fire from starting. This actually reminds me of a time where my mom actually went into the house and saw a little bit of smoke coming from the couch and realized that her laptop was on fire. She decided to just put a towel over it, which ended up being a horrible idea because then she actually burnt the house down. Luckily, no one was hurt, but it's a really good example to show that if you're just putting band-aids over problems and not actually, unplugging that laptop that's on fire or, getting out a fire extinguisher to deal with the root cause of the problem, then you're going to have even more major issues later. Same thing goes for inflammation. Now let's discuss advanced lipid testing. So apolipoprotein B and lipoprotein a. Conventional lipid panels can provide a general picture, but having advanced lipid tests give you a deeper look into cardiovascular health. Apolipoprotein B, which is also called ApoB, measures the number of atherogenic particles. So those small, dense LDL lipid particles that are more likely to lead to plaque in your arteries. They're more pro-inflammatory. They get in there in the walls and lead to oxidation, which leads to plaque. Lipoprotein a, or Lp(a), is actually caused mostly by genetics. This is a lipoprotein that can significantly increase your cardiovascular risk regardless of your other cholesterol levels. And really sad, it's not checked in any conventional lipid panel. You have to ask for it specifically. I actually just had a patient who was pretty young, a 35-year-old who thought he was really healthy because his LDL was within a normalish range, a little bit on the higher side, but pretty much normal. And he was very healthy, eating clean and exercising every day. So I decided that we needed to check at least one lifetime level of Lp(a). And when we did, I was so glad because it ended up being being way higher than normal. Armed with this knowledge, we started him on some advanced interventions, including some lipid management medications. These advanced lipid tests can reveal hidden risks that standard cholesterol or lipid test panels miss. This helps you take the steps necessary to protect your future, because the longer you're sitting around with these risks to your heart, the more time your arteries have to build up the plaque that can lead to issues that you can't reverse easily or at all with current technology. On a related topic, we have homocysteine. Homocysteine is an amino acid linked to cardiovascular risk, cognitive health, and overall longevity. Elevated levels of homocysteine in the blood are associated with an increased risk of cardiovascular disease through several mechanisms, including endothelial dysfunction. So the endothelium is the lining of your arterial walls. Oxidative stress. Oxidative stress is like reactive oxygen species, it's causing damage and killing off cells. Reduced nitric oxide, which is helpful because it can open up your vessels and allow blood to flow through more easily. And abnormal vascular smooth muscle cell proliferation. Elevated levels of homocysteine can be due to malnutrition or issues with B vitamin metabolism, specifically B6, B12, and folate, which is B9. So these are essential for reducing homocysteine levels in the body. For people who have the MTHFR gene mutation, and actually this is a lot of people, it's about half the population or even more in some estimates, the MTHFR variation impacts the body's ability to methylate these B vitamins. It may be necessary in this population to use methylated forms of B6, B12, and folate to effectively lower homocysteine levels. Methylation issues can lead to reduced detoxification, impaired DNA synthesis, and increased cardiovascular risk if not addressed properly. Elevated homocysteine is like a ticking time bomb for your heart and brain. Too much of it can really damage your blood vessels over a long period of time and lead to the risk of heart attacks, strokes, and even Alzheimer's disease. One of my recent patients had a really strong family history of dementia, and we discovered that her homocysteine levels were elevated. Even without testing her genomics, I could see that her blood levels of B vitamins were not actually that abnormal. They weren't that low. So you can tell with normal B vitamin levels in your blood and yet higher levels of homocysteine that there's probably something going on, like the MTHFR mutation. So we decided to put her on methylated B vitamins and adjusted her diet so that she could lower her homocysteine. And this can potentially reduce her risk of cognitive decline to a great level. Now let's talk about the hormonal panel. A lot of doctors really don't like being asked to test for hormones. And the reason why is because we aren't trained to read hormone levels at great detail. But hormones are so important. They're like the body's chemical messengers. They're responsible for regulating everything from energy levels to mood and muscle mass. Checking your levels of testosterone, estradiol, progesterone, FSH, LH, AMH, cortisol, DHEA, and other hormones can provide you valuable insights into how well your body is handling stress, maintaining energy, and balancing mood. For women, the timing of hormone tests is crucial, especially for estradiol and progesterone, because these obviously cycle up and down. These should be checked at specific points during the menstrual cycle to get an accurate picture if you're still menstruating. For example, estradiol is recommended to be measured in the early follicular phase, so around day 3 of a menstrual cycle, where day 1 is the first day of your period. Progesterone is recommended to be measured during the luteal phase, about day 21 in a typical 28-day cycle. You can imagine that this gets really confusing because not every person has a 28-day cycle. So we do allow for some variation. If it's day 2 through day 5 or even 6, that's probably fine. And then same thing around the day 21. We're looking for ballpark answers here. FSH, which is the follicle stimulating hormone, is crucial for understanding reproductive health and ovarian function, especially for women experiencing fertility challenges or irregular cycles. We typically check this on day 3 of the menstrual cycle for women who are still menstruating, because it can offer a signal of ovarian reserve when we compare it against the norm. Anti-Mullerian hormone, AMH, also provides a valuable measure of ovarian reserve. And that's, again, very important for women who are planning to conceive anywhere in the next even decade. So we want to understand fertility and we want to get all the data early on. For people dealing with hormonal imbalances, I actually often recommend a full cycle of continuous testing or even a couple of cycles. This is often done with urine tests at home for convenience. And a month of testing can cost around $300, which is not nothing, but I think it can offer incredibly valuable insights. Testosterone and DHEA can typically be measured at any point during the cycle for women, and obviously at any time for men. The important point here is to get free testosterone levels as well as the total testosterone levels, because the free levels indicate the actual testosterone availability for the body to use, rather than what's bound up by something called the sex hormone binding globulin, or hs-CRP. This hs-CRP is a protein that binds to and transports sex hormones in the blood to help regulate the amount of active sex hormones at any given time. It's necessary, but sometimes people don't love it because it can lower the availability of hormones like testosterone. DHEA is an interesting marker to test for because it is a precursor to your sex hormones. And so if you have low levels of that, then we know that there's something up the chain in terms of synthesis that's the problem. Oftentimes that's nutrition or some other lifestyle factor, like you're not sleeping well. Cortisol, our stress hormone, is an interesting one because we measure this in the morning to assess adrenal function more accurately. It's because we've set up standards for how to read the tests, and our cortisol levels go up in the morning to help wake us up. So it's a good time. If you want to get really accurate, if you go to an endocrinologist because they're worried about something going on, we actually can do throughout the day testing, often with saliva. I had a patient recently who was a busy executive who was feeling so exhausted all the time and actually pretty anxious and unable to sleep well. Testing revealed his cortisol levels were just chronically high and his testosterone was low. So these are classic signs of burnout of your hormonal system. We implemented stress management techniques, started resistance training, and used certain adaptogenic herbs to help support his adrenal health. And within months, his energy levels improved and he felt much more like himself. So hormonal imbalances can silently drain away your vitality, but understanding these markers and getting them tested allows for targeted interventions to get you back on track. Now let's discuss omega-3 index. The omega-3 index measures the level of omega-3 fatty acids in your red blood cells, providing us some insight into our long-term omega-3 status. So remember, we checked the hemoglobin A1C for sugar levels over a period of time. You can imagine the omega-3 index as a similar measurement except for omega-3s. Omega-3s are essential fatty acids for reducing inflammation, supporting cardiovascular health, and optimizing our brain function. It is actually probably one of my very favorite biomarkers, supplements, things you find in your food. It's just so incredible for your health. If you have a low omega-3 index, you may have increased risk of heart disease, poor cognitive performance, dementia, and mood disorders. For example, people with low omega-3 levels might feel more mood swings, difficulty concentrating, and even increased anxiety. Omega-3s, particularly EPA and DHA, are critical for maintaining healthy brain cell membranes and reducing systemic inflammation that can damage our blood vessels. So I had a patient once who was dealing with these very inexplicable mood swings. Like everything was going all right. But then I was like, there might be something to these mood swings and your trouble focusing. We tested her omega-3 index and found that her levels were incredibly low. By incorporating a lot more fatty fish into her diet and even adding on an omega-3 supplement each day, I was aggressively pushing her to 4 grams a day. Her mood stabilized and her concentration improved. Getting your omega-3 index tested can also guide you in how much omega-3 supplementation to add, because otherwise it's a bit unclear for each person whether 1 gram or the more aggressive 4 to 5 grams is necessary. Improving your omega-3 index can lead to better cardiovascular outcomes by reducing triglycerides as well. It can also reduce your blood pressure and prevent arterial plaque buildup. It's like this magical nutrient. Getting the omega-3 index test serves as a powerful indicator of how well your diet is supporting your long-term health and helps guide dietary or supplemental changes to optimize overall well-being. Next, let's talk about vitamin D. Vitamin D plays a vital role in bone health, immune function, and reducing systemic inflammation as well. Low vitamin D is incredibly common, especially for those of us who live in areas with limited sun exposure or have darker skin. Even myself, even though I'm just lightly tan like many Asians, the presence of melanin just blocks the sunshine that's needed to trigger vitamin D synthesis in our bodies. Vitamin D deficiency has been linked to a wide range of health issues, from weakened immunity to increased risk of chronic diseases of all kinds. I had a patient who was experiencing repeated stress fractures when running. And when I did a test, we showed that he had low vitamin D levels, which were affecting his bone health. And by supplementing with vitamin D and also K2 and magnesium, which assist in the beneficial outcomes of vitamin D, he was able to improve his bone density over a period of time and reduce his risk of future fractures. This supplementation and change in outcomes can actually actually take a long time, which is why it's important from an early age in one's 20s and 30s to start correcting any deficiencies. Regularly checking your vitamin D levels can also help you understand what you need to do in terms of supplementation, improve your future bone density, your mood, your immune resilience, and overall hormonal health as well. And this ensures that you stay strong and healthy. So this is not a blood test, but I wanted to talk about a couple of really important tests that are more specialized and important. Body composition testing. Some of us have scales at home that can help you measure body composition. But in my practice, I've noticed that there can be a difference of even 10% in the body fat. And that makes me worry about everything else too. Like, is the bone density accurate? So I prefer to rely on the gold standard, which is the DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry, which is a mouthful, so you could just call it DEXA. And this provides a detailed look at your body composition, including your bone density, body fat distribution, and your lean muscle mass. This is important to know. If you get a regular DEXA scan at a regular conventional radiology office, you're probably only going to get a couple of measurements of your bone density. And this is because conventional medicine only cares about osteopenia and osteoporosis. But we actually can use DEXA scans to judge how much muscle we've got on and how much fat we've got, including how much visceral fat, which is the fat inside your organs. And that is crucial for determining risks such as heart disease. We can also use MRI to detect body composition. This can go even more detailed, offering insights about the quality of muscle and fat tissue, and is particularly useful for identifying early signs of sarcopenia, which is muscle loss, or fatty liver. MRIs are a bit harder to obtain, so I don't use it in all practicality, but there are protocols where you just do a 15-minute MRI scan and you can get all of that information without any radiation. That being said, DEXA scans, even though they are x-rays, have very minimal amounts of radiation, so I'm not typically worried for people, unless you're trying to scan like every single month, for example. Understanding your body composition really helps us tailor specific interventions. So whether it's increasing muscle mass, reducing visceral fat, or monitoring bone health, these are all crucial for longevity and healthy aging. Now let's talk about some bonus health tests for optimization. So this is really going beyond the basics or even the early advanced biomarker panels. If you've already tackled the conventional and advanced biomarker panels, there are still more opportunities to refine your health. Bonus health tests that can provide even deeper insights and detail into your overall well-being. These tests are for those people who want to push the boundaries of what's possible, going beyond simple optimization to truly mastering their health. You might be a high performer, an athlete, or just someone dedicated to maximizing longevity. As a quick note, I recommend that you get these tests guided by physicians who can help talk through each of these results, because oftentimes you'll get results and they'll look scary or they might be misleading, especially if it's just one time. It's really important to get these advanced biomarker tests with a longevity physician or a physician who has experience reading these results. So beyond the basic hormonal panel, a more comprehensive look can help you understand your endocrine system more thoroughly. So we talked a little bit about the sex hormone binding globulin, which is the hs-CRP protein, which acts as a gatekeeper that controls how much testosterone or estrogen are actually available for your body to use. If you're experiencing fatigue, low libido, or mood swings, the shBG lab marker can be a key to unlocking what's really happening. Sometimes I get asked, how can you lower that if you want to free up more testosterone? We don't lower it. The way to lower it is to be malnourished and to have low protein levels, which usually means you've got a really unhealthy liver. Obviously, we're not going to do that. So this test is more taken to give us clues as to why your hormone levels might be low, not really to intervene upon. Then we have insulin-like growth factor 1, which is called IGF-1. This provides insights into our body's growth hormone activity, which affects muscle mass, aging, and even how well you bounce back after a hard workout. And like I mentioned, you can measure some hormones more continuously. For example, measuring cortisol multiple times throughout the day can reveal whether your stress response is properly regulated or completely out of sync. Same thing with the sex hormones that I mentioned, progesterone and estrogen. If you measure them throughout a month, a menstrual cycle's month, then you can get a bit more clues into what's going off at particular times in the cycle. Imagine being able to see a detailed map of how your body handles stress and knowing what to do to keep it balanced. Now let's talk about the complete blueprint, otherwise known as full genome sequencing. This is actually something that is rare to get done because it's a lot of information, but Full genome sequencing is like having a complete blueprint of your genetic code. It analyzes every gene in your DNA, providing comprehensive information that can help you understand your unique health risks, metabolic traits, and more. Unlike genotyping, which only looks at specific genes, so companies like 23andMe use genotyping, full genome sequencing provides a full picture of your genetic makeup. Even in some cases, parts of the genome that we don't really know the value of yet. This information can be extremely helpful if you're interested in a highly personalized approach to health, enabling you to make data-driven decisions about diet, exercise, and preventive healthcare. I think it's helpful for people who feel like they're doing all the right things, but still not losing the weight that they want to, or still not feeling well, or some other biometrics are off on their testing. There might be an unusual genotype in your genome that is leading to these results. Otherwise, it can also help you validate certain things. Like some people, they might have felt like, wow, I feel like I can't handle coffee like my friends can, and your genes can actually tell you why. As valuable as this is, whole genome sequencing can be quite expensive, and the sheer volume of data can be really overwhelming. So this is really best suited for people who are ready to dive deep into their genome with a physician's help. If you're not ready to drop $2,000 to $3,000 on full genome sequencing, or you don't want to be overwhelmed by too much data, genotyping specific genes can be a more accessible option. So genotyping, like I mentioned before, is done by companies like 23andMe. It's a lot more accessible because it's cheaper and faster. It focuses on certain important genes that we have more data about, giving you targeted insights without the complexity of sequencing your entire genome. Full genome sequencing analyzes every gene in your DNA and provides that comprehensive blueprint. But genotyping looks at specific variations to answer targeted health questions. So it's like looking up in a dictionary specific words that you care about rather than reading the entire dictionary. I want to talk about a few genotypes that might be valuable for you to check if you are interested in just specific genotyping. Knowing your ApoE genotype provides valuable insight into your risk for Alzheimer's disease and other conditions like heart disease. The ApoE gene has 3 variants: ApoE2, ApoE3, and ApoE4. ApoE4 is associated with an increased risk of developing Alzheimer's disease, while ApoE2 may offer some protective benefits. If you carry the ApoE4 variant, it's like an early wake-up call, one that could lead you to make really powerful preventive changes now before symptoms ever appear. People who have the ApoE4 variant can take actions like adopting a Mediterranean diet, increasing physical activity, taking omega-3 supplements, and focusing on cognitive health to reduce their risk. Meanwhile, people with the ApoE3 variant, which is the most common, fall somewhere in the middle in terms of risk. So understanding your specific ApoE variant can really personalize your decisions about diet, exercise, and mental health, which can directly influence your long-term cognitive well-being. And if you want to understand why certain B vitamins don't seem to work for you, you can get tested for the MTHFR polymorphism or genotype. The MTHFR gene affects your ability to methylate B vitamins, which is a step that's crucial for keeping homocysteine levels in check. This is a key factor in cardiovascular and cognitive health. If you have this polymorphism, taking the right form of B vitamins, the methylated versions, can be the difference between thriving or struggling with fatigue or brain fog, or even with early heart disease. Other important genotypes include the BRCA1 and BRCA2 genotypes. So these are associated with increased risks of many types of cancers, but most famously breast and ovarian cancer. So knowing your status for these genes can guide your screening and preventive measures, potentially saving your life and those of the people you love. If you find out that you have it, you probably want your relatives to get it checked as well. There's also the PARC2 genotype. So this reveals a genetic predisposition to Parkinson's disease. It allows you to focus on certain preventive lifestyle changes, such as maintaining regular physical activity and a diet rich in antioxidants. We have also the genotype COMT, which affects dopamine metabolism, and this can influence your mood, your focus, and stress response. I've also spoken before about FTO. This is the so-called fat gene, which impacts how your body stores fat and your risk of obesity, and provides us some insights that can help you tailor your diet to your genetic profile. There's the ACE gene, which is related to physical performance and cardiovascular risk, which can guide your exercise routines to match your genetic strengths. So testing these and many other specific genes can give you actionable insights without the cost or data overwhelm of a full genome sequence. So this kind of targeted genetic testing is perfect if you want to make impactful changes in your diet, supplementation, or lifestyle based on your unique genetic makeup. Now let's talk about the gut microbiome microbiome, which is such a key part of our overall health and longevity. The gut microbiome is like a bustling city with trillions of inhabitants, all working either for or against your health. Gut microbiome profiling can reveal which bacteria are thriving and which are lacking, offering insights into everything from digestive health to immune response and even mental well-being. For example, specific beneficial strains such as Bifidobacterium longum and Lactobacillus rhamnosus are known for their anti-inflammatory effects and their ability to support your gut lining's integrity. An overgrowth of harmful bacteria, however, like Clostridium difficile or Escherichia coli, which is known as E. coli, might be contributing to symptoms like bloating, fatigue, or anxiety. At a very extreme level, it can lead to full-blown infection, which can lead to serious issues, even hospitalizing you. There's also certain beneficial bacteria that I don't think we look at nearly enough, like F. prasinitzel, which is a major producer of butyrate, which is a short-chain fatty acid with anti-inflammatory properties. You want to have lots of these probiotics in your body to get the critical health benefits. Additionally, strains like Akkermansia muciniphila are linked to maintaining a healthy gut lining and metabolic health. We're actually starting to see supplements and probiotics that contain such strains packaged in a way that it's stable throughout your gut lining. So that's really exciting. Knowing the specific balance in your gut can guide our precise dietary adjustments, like increasing prebiotics or probiotics, or even taking certain pills as supplementation. Now let's talk about heavy metals. So heavy metals are stealthy saboteurs that can build up in your body over time, causing fatigue, brain fog, and even immune dysfunction. If you frequently eat large amounts of seafood or have had exposure to environmental pollutants through your occupation or lifestyle, heavy metal screening could be really eye-opening. Common metals that accumulate in the body include mercury, lead, cadmium, and arsenic. Each of these metals can have serious health effects. Mercury, for example, is known for its neurotoxic effects. So, real story, I had a patient who loved sushi, and during a month-long trip to Japan, she indulged in sushi for every single meal. By the end of the trip, she was already starting to experience some classic symptoms of mercury poisoning: fatigue, irritability, and difficulty concentrating. And she had even a little bit of tingling in her hands and feet. When we tested her for heavy metals, her mercury levels were off the charts. The good news was, once we identified the cause, we were able to start her on certain detoxification protocols, including chelation therapy and dietary changes to increase foods that naturally bind to and excrete mercury. So it is possible to get rid of heavy metals in your body. Within a few months, her symptoms significantly improved and her mercury levels dropped. So we talk about inflammation as a silent killer for a reason, because it can lurk under the surface for years and contributing to disease without obvious symptoms. There are advanced inflammatory markers that we can get tested as well. So interleukin-6, IL-6, tumor necrosis factor alpha, TNF alpha, and F2 isoprostanes can provide a nuanced look at your body's inflammatory status. Elevated levels can indicate chronic inflammation that could lead to conditions like cardiovascular disease or are related to autoimmune disorders. F2 isoprostanes, for example, measure oxidative stress, which is a kind of cellular damage that accelerates aging. This type of testing is somewhat more advanced, and I find that I don't typically need them because the more commonly available hs-CRP we discussed and also ESR are often sufficient to determine necessary interventions. But I also wanted to talk more about certain other oxidative stress markers that you can get tested for. So remember, oxidative stress is a key player in the aging process, and it can contribute to development of chronic disease. So measuring markers like 8-OHDG and F2 isoprostanes, like we mentioned, can give you a look at how well your body is coping with oxidative damage. So elevated levels might indicate that your body is under siege from pollutants from the environment, stress, or even a poor diet. There are some other common ones which I'll just briefly mention so that you know the names, like lipid peroxidation products. So these are called MDA, or the FD isoprostanes, which we discussed, and these are used to assess your lipid peroxidation levels. Elevated lipid peroxidation indicates the fats in your bodies are being damaged by free radicals, and that can lead to inflammation and atherosclerosis. So remember, when lipids get stuck in the walls of your arteries, that's not bad in itself. It's actually when they oxidize, it starts attracting macrophages and leads to the plaque formation due to the transformation of the macrophages into foam cells and then plaque. We can also test for oxidized protein. So protein carbonyls Advanced oxidation protein products, AOPP, and nitrotyrosine are examples of such markers. So these oxidized proteins can impair cellular functions and have been implicated in various chronic diseases, including neurodegenerative conditions like Alzheimer's and Parkinson's. Then we have DNA oxidation products. The 8-OH-DG is a commonly measured marker of oxidative damage to the DNA, and high levels of it are linked to increased risks of cancer and are indicative of significant oxidative stress affecting cellular integrity. Then we have OX-LDL. So remember, the oxidation of the lipids is very important. So high OX-LDL levels can indicate that heightened risk for cardiovascular events. Then we have MPO, which is an enzyme that generates reactive oxygen species and is involved with the oxidative modification of lipids and proteins. The elevation of MPO is often associated with increased heart disease risk and is an early marker for inflammation-related vascular damage. If you do find out that you've got really high oxidative stress levels in your body, you can take immediate steps like adding more antioxidant-rich foods, taking specific supplements and medications, or avoiding certain environmental toxins. This could all dramatically improve your long-term health. Feeling tired all the time, even when you sleep well? Your mitochondria, the powerhouses of your cells, might be struggling. So mitochondrial function assessments reveal how efficiently your cells are producing energy, giving you direct insight into your cellular vitality. Mitochondrial function can be assessed through several methodologies, each providing unique insights into different aspects of its activity. High-resolution respirometry is a widely useful technique that measures the oxygen consumption rate, or OCR, of cells or tissue homogenates. This allows for assessing parameters of mitochondrial function, including its basal respiration, ATP production, and maximal respiration and proton leak. So these are a lot of terms, but essentially it's measuring how well your mitochondria are functioning. There are other markers that we can measure as well, like mitochondrial membrane potential, which is measured using specialized probes, and they help assess the proton motive force and the oxidative phosphorylation efficiency. Then we've got biochemical assays. These are considered the gold standard for diagnosing mitochondrial dysfunction. This method involves measuring the activity of key enzymes like succinate dehydrogenase, SDH, in tissue samples, providing us direct evidence of mitochondrial function. Finally, you can measure metabolites in our blood and urine. So levels of lactate, pyruvate, and amino acids can provide indirect evidence of mitochondrial function. And the assessment of the oxidative stress markers and hormone-like cytokines like FGF21 can also be useful, although all of these tests do require a bit further validation. Mitochondrial dysfunction, though, is so important. It doesn't just lead to fatigue. It can manifest as muscle weakness, cognitive fog, and make it harder to recover from workouts. Poor mitochondrial efficiency can make you feel like you're running on empty, even after a full night's sleep or resting frequently. If you're looking to understand your cardiovascular health beyond cholesterol numbers, there are more advanced tests. This is deserving of an entire episode of its own, so I'm just going to briefly mention some of the tests so that you can recognize them if your doctor orders them. We've got the carotid intima media thickness, CIMT, and also EndoPAT. So CIMT measures the thickness of your carotid artery walls and can be a way to detect early signs of atherosclerosis. Even I, at an early age, I had this done because I have such a strong family history of heart disease that I wanted to know, do I have early signs of atherosclerosis? And indeed, it came back positive. So that's really concerning, especially when I had it done when I was quite young. EndoPAT assesses instead the endothelial function, so the ability of blood vessels to dilate properly, which is a key indicator of cardiovascular health. Then we've got something called the coronary artery calcium score, CAC score as it's called. CAC score measures the calcified plaque in your coronary arteries and provides this direct insight into your cardiovascular health. This is really interesting because, of course, if your CAC score is high, you've got a lot going on in your arteries. You want to make sure that you deal with that so you can tweak your diet, start taking medications, or ramp up your exercise routine. The problem with the CAC score is it only measures the mineralized plaque, which actually is the less dangerous plaque. Once plaque is hardened and mineralized, it's actually more stable. And so it's not likely to dislodge and cause a clot later on. It's still not great, of course, but it's just less dangerous than the unstable plaque. Unstable plaque is a little bit harder to detect, and you do need to get CTO angiogram, which is another type of measurement, of radiographic exam. And there's some specialized tests done by companies like Clearly, which uses AI algorithms to look at CT angiogram results and tell you how high risk you are for certain diseases. Finally, we've got full spectrum mineral testing. So micronutrients like magnesium and zinc are involved in hundreds of biological processes, from DNA repair to immune function to energy production. And deficiencies can lead to so many systemic issues like fatigue, anxiety, or poor sleep. So when you get full spectrum mineral testing, you can get the actual levels inside the cells to determine whether these vital nutrients are deficient and whether you need to supplement more or eat a more balanced diet. In a future episode, I'm going to cover the very wild and broad topic of biological age testing. Biological age testing is done in so many longevity clinics, and yet it is still very unproven and confusing. This is a work in progress, so I want to give it the attention it deserves in a completely separate episode. But you can get some estimate of your biological age, even with something like pheno-age, which is derived from routine clinical and laboratory data. So you can calculate it from the regular blood tests that you can get through your doctor. There's much more advanced tests, such as telomere length testing or inflammaging testing and metabolic testing as well. So there's a lot of different ways to measure biological age, and I'm going to be dedicating a future episode to it. We covered a lot today, from understanding the basics of a conventional lab test to diving deep into advanced biomarker panels and body composition assessments. So remember, optimizing your health isn't just about managing disease. It's about taking proactive, personalized steps toward a longer, healthier, and more vibrant life. If you found this episode helpful, be sure to follow, share, and subscribe at Hillary Lim MD everywhere. So stay tuned and stay healthy, because I've got more insights to help you live your longest, healthiest life coming up soon.